One of the most fascinating and tragic facts about idiopathic pulmonary fibrosis is that it's a scarring disease of the lungs where inflammation isn't the main problem. Instead, the disease seems to begin with repeated microscopic injuries to the alveolar epithelium, which trigger abnormal wound healing, leading to relentless fibrosis rather than repair. In most chronic lung disease, inflammation is the driving force, but in fibrosis, idiopathic pulmonary fibrosis, inflammatory plays only a minor role. The real culprit is a fibroblast activation and excessive extracellular matrix deposition, especially collagen, which progressively stiffens the lung tissue. So the term idiopathic means we do not fully understand what's happening, why this happens, but several clues point to aging. Some genetic mutations, maybe oxidative stress and environmental exposure, such as smoking. Smoking is a principal risk factor. Metal dust or viral infections. Essentially, the lungs' regenerative machinery breaks down, and instead of regenerating its course. Histologically, pulmonary fibrosis is characterized by the usual interstitial pneumonia, the pneumonia pattern, patchy interstitial fibrosis with honeycomb changes, fibroblast foci, and temporal heterogeneity. These fibroblast foci are areas of active fibrosis, a hallmark of the disease. Honeycomb changes, honeycomb lungs. Clinically, patients present with progressive exertional dyspnea and dry cough. On examination, you'll often hear Velcro-like crackles at the lung bases, a classic finding. Clubbing of the fingers is also common. Radiologically high-resolution computer tomography show basal and subpleural reticulation, honeycombing, and traction bronchiectasis, the classic pneumonia pattern, interstitial pneumonia pattern. What was truly fascinating and sobering, it's despite all our advances, pulmonary fibrosis behaves more like cancer than inflammation. It's relentlessly progressive and has a median survival of only 3-5 years after diagnosis. Yes, there is no malignancy, just disordered tissue repair. Modern treatments like pirfenidone and nintedanib can slow fibrosis, but they cannot reverse it. Lung transplantation remains the only curative option. Sad, yeah. Stay blessed.